So what is an intra-aortic balloon pump? So essentially, an intra-aortic balloon pump is an intravascular volume displacement device. So what it does is basically it displaces the blood in the aorta, and at the same time is able to reduce the workload of the ventricles and increase ejection fraction during systolic. So what really confused me a lot of times was the word augmentation. I never really understood what it means. We're augmenting diastolic pressure. What does that mean? So by definition, what augmentation means, or to augment, is just to make greater, because you might hear that we're augmenting the diastolic pressure. You might hear augmentation. What that means is we're just making that diastolic pressure greater or bigger, so it could help push blood into the coronary arteries. So it could help better perfuse the myocardium. So when you hear of augmented diastolic pressure, it means the diastolic pressure is being helped. It's being helped to make it a little bit greater, so pressure increases, and it's able to help perfuse those coronaries during the phase of diastole. So what are some indications for an intra-aortic balloon pump? Acute MI, cardiogenic shock. You can have acute mitral valve regurg. You could also have a ventral septal defect going on. For cardiac surgery, cardiac catheterizations, as well as any kind of cardiac surgeries or angioplasties, ventricular arrhythmias, unstable anginas, and also refractory ventricular failure. So a lot of our heart failure patients are going to get this balloon pump. A lot of patients that are undergoing cardiac surgery will get this as well, just to help support the cardiac function while they're going through this very, very rough phase for the heart. Cardiac surgery puts a lot of stress on the heart. So we want to minimize that stress as much as we can. So we like to put on an intra-aortic balloon pump to help their heart work a little bit less while still perfusing the body and still increasing the cardiac output. So what are some of the hemodynamic effects? I want to go through how it affects 4 things of the heart, but we're going to simplify it down because you don't really technically need to know all this. It's good knowledge, but when it comes to your basic bedside care or how to troubleshoot or how to figure out what the intra-aortic balloon pump does, all you need to really know is these 3 things, but let me go to each part of the heart and how it affects it. So basically, the intra-aortic balloon pump improves the failing heart by increasing myocardial oxygen supply, and at the same time, decreasing the myocardial oxygen demand. So in the aorta, it decreases systolic pressures and increases the diastolic pressures depending on inflation and deflation. In the left ventricle, it decreases systolic pressures, decreases end diastolic pressures, decreases volume, and decreases wall tension. So you can see how if somebody has left ventricular failure, this intra-aortic balloon pump helps to ease that stress and that tension on the heart by not only affecting the pressures, but also helping with the wall tension. In the heart, it decreases afterload, decreases preload, and also increases cardiac output. And blood flow, it increases coronary blood flow and coronary perfusion, as well as systemic perfusion.